Hello everyone and welcome to my channel. Today we are going to study about CT scan of brain. Let's see how it looks normal and what are the pathology it can be seen in CT scan. Normal vs abnormal. It is not possible to call an image abnormal if the normal appearance is not known. In order to recognize the abnormal, first need to know the appearance of the normal. On non-contrast head CT, bone is white, calcium is white, acute hemorrhage is usually white. Light grey, brain parenchyma is light grey, white matter is darker than grey matter, CSF is very dark grey, sulci, cistern and ventricles are charcoal grey. Black, air is black, nasal cavities, sinuses and mastoid air cells are black. Systemic approach to reading a head CT. First, check brain parenchyma, check grey-white differentiation, check gyri, look for blood. Surgeons need to know size of hematoma, extent of midline shift, herniation. Second, check CSF spaces, ventricles, check cisterns and sulci. CSF space, ventricles and cisterns. Size, symmetry, midline shift, herniation. Subsulcine, sanguinates, gyrus, cross flags, transcentorial, temporal lobe into tentorial notch, cerebellum into foramen magnum. Now, third number, check face and skull bone on bone window. Do not confuse sutures with fracture, especially in pediatric patient. 4 number, check air spaces, sinuses, it contains air, nasal airway, ear canals and mastoid air cells. Let's see some of the normal CT scan with labeling. It consists lens, globe, basilar artery, middle cerebral pedal. What are the things we need to study while studying normal brain with contrast? First, we see the normal size and configuration of the ventricular system. NEC midline shift, no intercerebral or extraaxial areas of abnormal attention values, recent blood density is there or not, or enhancing lesion. See normal appearance of the brain stem and cerebellum. See scanned paranasal air sinus are clear or not. If everything is okay, then we can give normal study. Also check if there is any hematoma or any AV malformation. Everything we need to check. Let's see some of the parts of normal brain. Anterior horn of right lateral ventricle, caudate nucleus, upper portion is sulcus, behind that there is septum pedicellum, middle one is third ventricle, lanciform nucleus, down one we will see cerebral vermis, in down we see right occipital lobe, white matter, cortex. Normal brain anatomy: eye, optic nerve, sphenoid bone, temporal lobe, right side sella turcica, down that petrous bone, mastoid air cells, pons, after that fourth ventricle and cerebellum. Next image, frontal lobe, lateral ventricle, frontal horns, caudate nucleus, salvular fissure, insula, lentiform nucleus, internal capsule, thalamus, pineal gland that is calcified, choroid plexus that is also calcified. Now down that there is occipital lobe. Let's see some of the pathology. What to look for in head CT? We will see first brain tissue, pre-contrast, bone contrast, bone detail, After that, abnormal opacity, abnormal radionuclicity, distortion or displacement of normal structure, any hematoma, any midline shift is there or not, abnormal radionuclicity is there or not, any mass is there or not, everything we need to see. This is the case of epidural hematoma. What are things we can see? Let's see from the beginning. Right peritoneal subdural hematoma, 6 mm hematoma is there, and little bit midline shift is there. That is a midline marker. Right temporoperitoneal epidural hematoma is there, 1.8 cm. 6 mm leftward shift of lateral ventricle is there. Right lateral ventricle is there. Left lateral ventricle is there. Now at last, efferent of right sulci is also there. Stroke. General symptoms of stroke include sudden numbness, paralysis or weakness in face, arms or leg, especially in one side of body. New problem with walking or balance. Sudden vision change, drooling or slurred speech. In stroke, there is sudden onset of neurological defeat attributable to a vascular cause. A stroke results from lack of blood flow to an area of the brain. Without adequate blood flow, the neurons, nerve cells in the brain will begin to die. Subdural hematoma are usually the result of a serious head injury. When one occurs in this way, it is called acute subdural hematoma. Acute subdural hematomas are among the deadliest of all head injuries. The bleeding fills the brain area very rapidly, compressing the brain tissue. This often results in brain injury. There are different patterns of edema. Vasogenic, that is interstitial, or cytogenic, that is intracellular. Interstitial white matters only edema will be there, but cytogenic in intracellular both gray and white matter edema will be there. In vasogenic, neoplasm abscess. Vasogenic edema, tumor inflammation will be there. And infarction, cytogenic, more infarction will be there. Cytogenic edema or infarction, that we can see in right side. And vasogenic, that is neoplasm, we can see in left side. Multiple sclerosis or MS is a disease that affects the brain and spinal cord, resulting in loss of muscle control, vision, balance and sensation. With multiple sclerosis, the nerve of the brain, spinal cord damaged by own immune system. Thus, this condition is called autoimmune disease. Hydrocephalus versus cerebral atrophy. Hydrocephalus is abnormal accumulation of intracranial fluid resulting from the structural or functional block to normal flow of CSF. Cerebral atrophy is a parenchymal volume loss. In this image we can see different types of hematomas. First, left side upper, we can see epidural hematoma is there. Down the left side we can see subarachnoid hemorrhage is there, that is called SAH. In right side we can see subdural hematoma is there. Below that we can see parenchymal hemorrhage is there. This is a different type of hemorrhage in the bleed, which can be caused by different reasons. One of the main reason is hypertensive or aneurysm, or can be due to stroke, or also can be due to trauma, and many more. This is the case of chronic subdural hematoma. In this hematoma, the hematoma is less dense than the adjacent brain parenchyma. Note that affected left lateral ventricle. This is the case of NCC, which we can call neurocysticercosis. Is an infection by a parasite called Taenia solium, T solium, a pork tapeworm that creates cysts in different area in the body, and also brain calcified stage of larva of Taenia solium will be there. Contrast and non-contrast, both CT scan is helpful in diagnosis of this neurocysticercosis. This is the case of mass which shown in both non-enhanced CT and contrast CT head. In non-enhanced CT shows hypertense mass resulted in the midline shift to the right speck in the left frontal lobe, and in contrast enhanced CT shows homogeneous enhancing mass located in the left frontal lobe, and in the DSA mass is clearly seen. This is the case of isodense subdural hematoma. In this CT image with contrast demonstrates an isodense subdural hematoma in the left frontoparietal region. This is the case of contusive brain injury, a specific area of brain injury located directly opposite to the site of impact to the head that results from linear violent collision of the brain with the skull. Here an injury usually involves the brain in which the tissue damage is on the side opposite the trauma site, as when a blow to the left side of the head results in brain damage on the right side. This is the case of an extratural hemorrhage where there is bleeding between the inside of the skull and outer covering of the brain, that is called dura. This is the case of arteriovenous malformation. The cause of cerebral arteriovenous malformation (AVM) is unknown. The condition occurs when the arteries in the brain connect directly to nearby veins without having the normal vessels capillaries between them. This image shows anxiotic brain injury. It is caused by lack of oxygen going to the brain. The brain begins losing brain cells after only 4 minutes without oxygen. This is the case of brain abscess, where there is abscesses collection of immune cells, pus and other materials in the brain, usually forms of bacterial or fungal infection. Alzheimer is a brain disease that causes problems with memory, thinking and behavior. Symptoms usually develop slowly and getting worse over time, becoming severe enough to interfere with daily tasks. Here we can see clearly healthy brain and advanced Alzheimer's brain, how the brain is losing their cells. Thank you for watching. If you have any queries, please comment down below, and also don't forget to like, share and subscribe. Thank you.